Hi, my name is Brianna. I'm going to be doing a presentation on the normal physiological changes with age. So, what does age affect? Age affects the bones, it affects the vision, the hearing, it affects the respiratory system, the cardiovascular system, the renal system, and the digestive system. Those are the topics that I'm going to focus on today. So the objectives for this presentation is to give you a better understanding of the normal changes with age and to teach you the signs and symptoms of the normal physiological changes. So the first thing I'm going to talk about is the bones. The bones become weaker, they shrink, they lose density, and they are more susceptible to fractures. This is because the calcium is sucked from the bones to nourish the body because the body is not getting enough calcium in their diet. The next thing I'm going to talk about is vision. So many things can affect vision, and vision can be affected in many different ways. So some of the things are glaucoma, dry eyes, macular degeneration, and cataracts. Some of these can be corrected with surgery, with glasses. Some of these cannot, and unfortunately that is a common thing that happens with our elderly. So the next thing is hearing. Hearing loss is very common in our elderly population, especially with people who have been around prolonged louder noises, worked in an area where they were constantly using heavy equipment and not wearing earplugs. So the next thing we're going to talk about is the digestive system. So we're going to start with the mouth. So the teeth, they start to lose their teeth. They could get gum disease, which is very common. The stomach decreases in size, and the digestive enzymes begin to decrease. So with this, the food isn't breaking down like it should. The next thing we're going to talk about is the renal system. So the renal system, the medications aren't being broke down like they should in our kidneys, which causes a lot of issues for our elderly. The next thing I want to talk about is the nephrons start to lose function, and the heart does not pump blood as much as it should. So the next thing I'm going to talk about is the cardiovascular system. So with the cardiovascular system, anything that's wrong with the cardiovascular system, you have diminished energy. The heart valves become thick and they can become rigid. There's a decrease in cardiac output and the decrease in the stroke volume. There can also be a fatty plaque buildup in the arteries or the blood vessels, and this causes a lot of issues for our elderly population. The next thing I'm going to talk about, the last thing I'm going to talk about is the respiratory system. So with the respiratory system, it's not just like a chemical change. There is a chemical change a lot of times, with the decrease in the gas exchange and whatnot, but it can also be the airway restriction, the obstruction of the airway, with patients who have sloped backs or have the decreased mobility in their ribs or decreased muscle. This all affects the respiratory system and is common with people as they age. So that's everything for my presentation. There are more notes and comments and more information on the PowerPoint if you want to go ahead and look and follow along with the presentation. Thank you.